Hi everyone, Dana Phillips, family nurse practitioner here with All Things Nurse, your place for nurse advice. I'm going to tell you the stuff that they don't teach you in nursing school. And today I'm going to talk about how to pull from your resources. I once had a grad school professor respond to an email of mine. I had emailed her with a question and she said, "You need to learn how to pull from your resources." And I said, okay. So if one major thing I learned in grad school, it was how to use my resources. And these days, with a smartphone in our pocket at all time, we have a literal encyclopedia, a dictionary, a plethora of knowledge at our fingertips. The access has never been like this before. When I first became a nurse in 2008, I think smartphones have just come out. So we've come a long way. There's so many different apps, and I'm going to talk to you today about some nursing apps that I personally enjoy using and find extremely helpful. Now, pretty much most nursing apps are at least free for like a week or a month for a trial. And then if you find it valuable to your practice, you can go ahead and subscribe and pay whatever their yearly fee is, whatever. But the first app I'm going to talk to you about is Medscape, and you can use a free version of this, and it gives you a lot of information still with the free version, and you can access diagnoses, medications, references, articles, all right on the app, and they have like daily pop quizzes on it that you can look at as well, and lots of really good visual aids. So Medscape app. The second app I love, Epocrates. So there is a free version, or you can pay for the yearly subscription. It's $174.99 for the year. I personally pay for the yearly subscription. It gives you access to more stuff, and I use Epocrates app all the time when I'm in the office in primary care taking care of patients, and it's just like answers at your fingertips. Boop, 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 pops right up. And the third app I'm going to talk to you about is the Medical Dictionary by Farlex. It's exactly what it sounds like, medical dictionary. If you forget the terminology for something, or you need to look up a diagnosis a little bit further in detail, you can go ahead and use this app, and it's just extra information right at your fingertips. The fourth app is the Nurse's Drug Handbook. And that's exactly what that sounds like too. Access to all kinds of drugs. It gives you mechanism of action, half-life, dosages, all the things. So I highly recommend that app. It's very easy to use, very easy to read. The fifth app I'm going to talk to you about is MedCalc, MD Calc. So this is really great, especially for nurse practitioners. You can do risk assessment algorithms on it for like cardiovascular risk assessment and whatnot. You can use a BMI calculator on it. They have like a whole list of different tools and resources for you to browse through on the MD Calc app. So check that out. And then some pediatric specific ones. There's PD Quick Calc. I think that's like $4.99 for the subscription. That can give you like weight-based dosages for medications. I know sometimes that can get confusing with the PD patients, with the kilos per milligram or whatever the dosages for whatever medication you're giving. So it is always good to have these resources to double and triple and quadruple check any kind of math equations when we're dosing out medication. And then I'm going to talk to you about 3 more apps in regards to board prep. So the first one is NCLEX RN by Mastery. That is obviously for NCLEX preparation. The Mastery platform is amazing. It gives you like access to like thousands and thousands of practice questions. So I highly recommend it. You can pay by the month. I think it's like $25 a month. Personally, for me, I use the FNP by Mastery, which is the next one on the list for board prep for nurse practitioners. And I think it was like $25 a month. it was like the best $25 I could have spent. And what it did for me was I would just like sit on my couch, breastfeeding my baby, and just go through practice questions over and over and over and over. And it was that repetition that I believe that really helped prep me for my boards, on top of a couple other things that I did that I can definitely talk about in another video. And then the third board prep app is called Picmonic. I don't remember how I found out about this app, but it's very quirky. So there is a free version, and then there's also, you know, a subscription to access more info. I'm not sure how much it costs per month, but I can't remember. But the Picmonic is for you visual learners. It will literally give you like this really weird illustration of whatever it is, like a diagnosis. And it will give like a little like 2-minute like story about it. And it will kind of diagram out like the weird intricacies of the diagram. And it's kind of like Salvador Dali-ish, like really like weird stuff. And so for you visual learners, it's like a really good way for it to give you that like visual brain memory recognition. I used it a little bit for my board prep for family nurse practitioner. I did find it to be helpful, but I don't think I used it to the fullest of its capability. So definitely check it out though. I think it's very, very valuable. So if any of you have any other resources that you love or apps that you find extremely like amazing, you can't live without them, go ahead and leave some comments. Go ahead and like this video, subscribe to my channel, and I'm going to be putting up videos daily about ways to live life better as a nurse, the stuff they don't teach you in school. Have a great day.